Welcome back. COVID-19 is back in the news again. We are falling back into the routine of waking up and checking how many new cases have been reported. In the last 24 hours, that number is more than 5,600, along with 21 deaths. India's total death toll from COVID-19 has now crossed the 5,31,000 mark, across all the waves, that is. The Union Health Minister has already chaired a review meeting with health ministers of state governments. Partial mask mandates are back in states like Kerala, in Mumbai, Rajasthan and Delhi as well. Mock drills have been held in public and private hospitals across the country. Now, if you look at the weekly numbers, they are up by 79%. Here in the national capital, more than 480 cases were reported in the last 24 hours. The positivity rate is more than 26%, meaning 1 out of every 4 tests are turning positive. The government, that's the Delhi government, has asked people with flu-like symptoms to stay at home. Delhi's health minister says they will implement all instructions coming from the sector. The big question is, what's driving this sudden surge? Are the vaccines losing their efficacy, or has this become the new normal? Let me go across to Dr. NK Arora, who heads the COVID advisory group for the central government. Dr. Arora, thank you very much for joining us here on Mirror Now. They say it isn't over till it is over. Clearly, COVID isn't over. That is what the current numbers that are coming to us are telling us.
Yeah, thank you very much for inviting me. And I would like to tell our viewers 3 or 4 things. One is that in January, we had reached an nadir of less than 140, 150 cases a day. And as you very rightly said, today it is nearing 6,000. And when we look at the genomic surveillance going on in this country, we find that 90% of the viruses which we are seeing at the moment in the country are what is called as XBB. This is a recombinant virus, which 2 viruses have come together, and this is a form of Omicron. And within that 90%, there are 12 or 13 varieties of this XBB variety. And one variety which all of us keep hearing quite a lot in the press and otherwise, XBB 1.16. Now, these names are important from a very scientific point of view, but from a very practical point of view and from a common man's point of view, it does not really make a difference. The key issue we have to all be vigilant, and that is there an increase in the hospitalization rates? Is there an increase in death? And fortunately, we see that despite these increase in the numbers of positivity and positive cases, the hospitalization rates and severe disease has not actually increased, which is a redeeming point and the comforting point. And the important thing is that why is this sudden increase? It appears that this particular mutant XBB virus of Omicron is causing more breakthrough infection. So even all those people, there has been analysis of the cases, and all these individuals have already got vaccines, at least 2 doses, and about 30% have also got precaution dose. So all in all, what I'm trying to say is that this current upsurge is causing a URI, like a common cold-like symptom. It is not associated with severe disease. But we need to be careful about 2 or 3 category of individuals. One, those who are above 60 years, those who have comorbidities, and third is those who have immunosuppression or immunocompromised state, if they are cancer patients, they are on steroids or those kind of things. But otherwise, I would like to assure that we should not get panicky. This is likely to be a short-lived. And as the virus also, viruses are keep changing. I must here also share that during last 15 months, almost 400 plus variants of Omicron have appeared in our circulation. So this is a very fragile virus, keep changing. And I think this particular virus is a little more infectious, and we are seeing this outbreak.
Okay, Dr. Arora, then you're telling me that we are not seeing the beginning of a fourth wave. That is something you're telling us. I want to ask you whether we should worry about children, because there are reports that are coming out in newspapers where doctors are saying that they are seeing, a rise in the number of children who seem to be afflicted with COVID-like symptoms. Is there any need for parents to worry? And if yes, what are the symptoms that they should be looking out? Because there is not just COVID right now, there is also the common flu, and there is adenovirus as well.
So you have asked, Shreya, you have asked me two questions. One is, are we talking about fourth wave? This is certainly not fourth wave. This is Omicron and its sublineages, which started in November 2021, and that same thing is continuing. So, and the second thing is that children, like adults, can also have mild illness like common cold. It's not very common. So if there are others who are infected within the family, the children, if they are there, they will also get infected. But we don't see any severe forms at all in these children. So therefore, I would like to assure that parents need not get panicky. And if somebody has infection within the home, and infection means symptoms, that means fever, cough, nasal discharge, they should consider that it may be either COVID or any of the other circulating viruses like influenza, or there is another virus which particularly affects children is RSV virus. And most of the times these are mild illnesses. Sometimes RSV below 2 years or 3 years of age, RSV causes very severe disease in children. So we should not consider every illness in children as COVID. These are other viruses are also circulating. All in all, we have to be vigilant and get the testing done. In case somebody is infected, we should see that there is some kind of a reverse quarantine. The person, the other children and the elderly in the family should keep away from that symptomatic person so that they don't get the infection.
Dr. Arora, my last question. I'm running out of time, but I think I need to ask you this. Given that Delhi's positivity rate is 26%, is it time for the mask mandate to come out as far as going out in public is concerned? There are some states who are saying do it, but I can fly from one city to another without wearing a mask, while we know that an airplane is a crowded place, everyone is sitting in close proximity, airports are packed with people. Is the government considering bringing the mask mandate back in public places?
So, as I said, the illness is mild. I must also say that we as Indians have behaved very disciplined manner when the whole pandemic was at its peak. At this time, I think we need to be careful, particularly those who are above 60, and if they are going in crowded place or they are traveling, for example, as you gave the example of in a flight, or those with some illnesses. The third thing is most important, that those who are symptomatic, for their own safety, safety of their family members and the rest of the people, they should be wearing masks.
Okay. Dr. NK Arora, thank you very much for joining us. It's important what you're saying. You're telling us that we are not seeing the beginning of a fourth wave. Don't panic, but be vigilant. Dr. NK Arora, thank you very much for your time here on Mirror Now. With that, it's a wrap from me, and it's over to Afrida, who will be joining you at the top of 7 with all the big headlines.